As part of BBB's Give.org Building Trust series, we're here today with Beth MacNairn, Deputy Director, Health Volunteers Overseas. How are you, Beth?
Fine, thank you. How are you?
Tell us about the scope and mission of your organization.
Well, Health Volunteers Overseas, or HVO, was founded more than 30 years ago to address the critical shortage of health workers in low and middle income countries. Today, we work with more than 27 countries, more than 100 partner organizations, and we work across 18 different clinical specialties in more than 100 programs. And what we're trying to do is to develop the skills and knowledge of health workers in these countries, in low-resource countries.
What is the biggest challenge facing the communities you serve?
Our main community, our direct community that we are working with, are healthcare providers and those in training. We want to make sure that they have the educational resources, the training, the knowledge and skills that they need to provide quality care. And I think the biggest challenges they're facing are opportunities to learn and to grow and to continue to develop their skills. Many healthcare providers are isolated. They have overwhelming workloads, and we need to provide them with support.
How do you measure the impact of your programs?
So we have a logical framework that we've developed to look at what are we measuring and why, who are we trying to impact in what ways. And then we've developed very specific tools over the last 5 to 6 years to measure our impact. And those tools include online surveys where we talk with all of the different stakeholders.
Do you engage in collaboration to help achieve your mission?
I'm so glad you asked that, because partnerships are really fundamental to our entire model and allow us to have impact. So we have a lot of different kinds of partnerships. I mentioned the universities and teaching hospitals where we do our work, and the students and faculty. We have partnerships with professional associations in the United States, like the American College of Physicians and other organizations who sponsor our work. We have partnerships with corporations who support us. And then we have donors who support our work. And then, of course, our volunteers who are also partners in realizing our mission.
What does it mean to your organization to be a BBB's Give.org accredited charity?
It's vital that we are viewed and reviewed by an independent organization like yours that has standards. So for us as a small NGO with no marketing budget at all, it's just critical that we get that seal of approval.